New Age Parenting, presented by Neelkanth IVF Hospitals. We have the experience. Powered by Psychorian Matrimonial. Ek Rishta Vishwas Ka.
Hello and a very warm welcome to New Age Parenting. Once again, a very big thanks to all the parents out there and all the kids who've been becoming a part of this platform. One thing which I would like to share with all of you is that when I had started this series 4 months ago, 5 months ago, my purpose was to create awareness about these new age kids with the parents, and of course to let these new age kids know that yeah, we understand. But the response I have got, in fact in these 6 months I have met 6 to 7 parents who have faced that their children are not wanting to be with them. They've just left them. These 15, 16, 17-year-old kids are not wanting to live with their parents. And parents are at loss at what has happened to these kids. Because parents are so disconnected, they are not, even if we feel today that we know everything about our child, but maybe there are few things which we are not understanding. And most of the parents whom I met, in fact the problems were that they, the couple themselves were at loggerheads, they were having their problems. The disconnect between the parents, the mother and the father, is creating a lot of havoc for these new age kids, and they don't want to be part of that fight. So please, all those parents out there, just be more connected with your child, and all the differences you have with your spouse, you need to work on, because if you want your child to remain with you, to be on the positive path, you'll have to create positivity in your life. If you want to get separated, please stay separate, but don't continue to fight, because these are the few things, few feedbacks which I am receiving through emails and through meetings also. And as I had promised that we would be talking about the infertility part and how the couples who've not been able to get kids, there are possibilities. So in this episode also today, we would be talking to Dr. Bindu Garg, who is an infertility expert, and we would like to actually bust a lot of myths and also understand more about IVF. The time now for soul searching. In our soul searching segment today, once again, we have Dr. Bindu Garg, infertility expert from Neelkanth Hospital. A very warm welcome, ma'am. We have a confession today. Yes, last few episodes we have people who really approached us, and then there is a lady who wanted to talk about what the kind of trauma she's going to, she's going through, and of course, a lot of pressures what she's going through. So let's listen to her.
I've been married for last 5 years, and I haven't been able to conceive. I have been showing to a lot of doctors. We've gone there. And today, my husband, who is in one of the major corporates, is not ready to accept that there can be a problem with him. I haven't been able to conceive for last 5 years, and we have been showing to a lot of doctors. The doctors said that after we did a checkup, we came to know that there was some problem with my husband only. He had a problem with his sperm's count. What happens? My mother-in-law was there with me. I'm desperate to have a child. But then my mother-in-law says nothing is wrong with her son. She doesn't want him to go for a treatment. I want to go through a treatment, but then I don't have a problem. Problem with this is with my husband. Last year, around 4-5 months back, I somehow convinced my husband to go with me to some doctors. When they told him to go through a treatment, he said, no. He started blaming me. It's actually very sickening to know that today a person says he's educated, he knows the world, he sees the goes through the internet, he sees what's happening, but he's not ready to accept that there is some problem with him. He, as well as he came down to the level of saying that there is something wrong with his manhood, which is not acceptable. He told me that you don't come with me to the doctor, I will go. And can you imagine being so educated, he still went to, as we call them, those roadside doctors who claim that they'll be able to give him certain medicines which will help us having a child. But then I don't think that's the right thing. What is it that I should do? Is there any way I can convince my in-laws?
Ma'am, now we've heard what she is going through, and I think there are a lot of women who must be going through
Very
that.
common.
Yeah.
Very
So what
common.
should she do now? What is the answer?
See, answer is that yes, she has to be bold enough. And I always tell that you talk to the mother-in-law, that see the problem. See, it is not a matter whether the problem is in me or my husband. We want a baby. The ultimate goal is getting pregnant. And if we feel that wherever is the fault, that has to be corrected. But in my 25 years of practice, I have never seen, if you counsel them well, they ultimately agree to everything. But basically it's a counseling session with mother-in-law, with even the mothers sometimes come. There are so many cases where mother also comes because they feel that my daughter is going under trauma. They also make them realize that, see, it's not my daughter or your son. So it's, let us be together and get the proper treatment done.
Through this platform, you know, I would again request you to tell us that if man has a low sperm, you know, sperm count, or there are no sperms, is it a disease? Is it an indication that he is not a man enough?
It's absolutely nothing with the manhood. Because you see them, there are so many educated people, ultimately they realize why it happened, they come to us, madam, why it had to happen to me also. Suppose a person is coming to us with no sperms, we never say no sperms, there could be a blockage also. So we always tell them, go for a test which is called as a fine needle aspiration cytology, and sometimes even we go for a testicular biopsy also. We take a small tissue, it's a small cut which is given, and we take a small tissue, and then we make sure that the sperms are being formed or not formed. If the sperms are not being formed, then of course, then we have other options to go for a sperm banking. But if there are sperms there, but the count is less, then there are medicines, and if the medicines don't work, there are now the latest procedures which are called as intracytoplasmic sperm infusions. So there is a treatment to all. It is just that you agreeing to it, that let us get investigated and let us know what is the cause, and then do the proper treatment for it.
And
so it is not anything that you are not a man.
And the way she was saying, you know, that he started going to these street people who actually keep on saying that they can help, and there's a lot of trauma for the man.
This is
also
very common, resorting to all these traditional methods. So we always guide them that, look, be very careful in taking these traditional methods. They are not that they don't work, but before you take them, make sure that they'll not do any harm to the body, because sometimes they can have your organ problems.
How about the medicines, allopathic medicines also? Are there side effects?
Side effects, see, there is an effect, there is a side effect of every medicine, but then you have to weigh the effects. And if we feel that yes, these are the side effects, we always tell them, and once we feel that the side effects are there, we stop the treatment, we stop the medicines. So it is not that you are not being monitored. If we are giving you anything, you are being properly monitored, that yes, this is not having any untoward reactions towards
So then every treatment should be done under
the supervision. Suppose if we are giving them the injections to make the eggs, we always see them that the ovaries are not getting hyperstimulated. The patient is not having any problem with these drugs. Suppose they are feeling any giddy or anything, then there are treatments for the side effects also.
You know what this lady is talking actually is the trauma of lot of Indian women, you know, especially if you are not coming from NCR or these metros. There also I think women are going through. What is it you would suggest, that what should she do?
I personally feel that the men should be taken in confidence. There should be a proper between the wife and the husband. Then that coordination should be more, and husband should realize that it's not whether my problem or your problem. They should act smart, and they should be more caring towards their wife, because they know that it's the problem is that can be solvable. So they should tackle the family problem in a more positive way and done in a proper way. I personally feel that it should be the decision of whole family, but if the person feels that something should be very confidential, after all it's their life. But if there is any problem, and I don't think there's anything to hide, you just have to tell to the people that yes, look, we have a problem like any other disease. Suppose there is a heart surgery undergoing, then the family supports.
Yes.
So similarly, we want a support from others also. Because if there's a support from the family, then they don't have to tell a lie that where we are going. Otherwise, many people, they tell a lie that now we are going here, there, and then the mother-in-law says, where are you going every day? But if you have a family support, if you have a financial support also from the family, the treatment becomes easy.
What have you seen that usually the family basically agrees for these procedures?
Yes, absolutely. Absolutely. I'm yet to see, there are very stubborn families, but with time. Because 4, 5 years, 6 years, they give some time. No, not going. We are not doing this. But when they feel that nothing is working, and they know that now it is high time that they should go for a proper ethical treatment, then they agree. Because it's a social pressure, not from that family, from the relatives, from the neighbors, from the village. So they agree. Everybody agrees.
And the way you had said in the first episode also that the earlier the better. So as the age grows, all these procedures also become little tough.
They become tough, the success becomes less. And after so much of emotional trauma when they come, so it's a very hard to go to a doctor again after so many years of working with these methods and accepting now they have to undergo all these procedures and fiddle with the body. So this becomes acceptance also after so many years becomes a difficult process. And then, see, sometimes it's not sure that you conceive in the first cycle. That is what we always counsel, maybe first, maybe second, maybe third also.
Dr. Bindu, in Soul Searching, we've really understood a lot of things, which people have these apprehensions. But at this juncture, we'll take a short break. We'll be back soon. You can call us at our toll-free number 1800-102-6706, or you can mail us at ivf@neelkanthhospital.com. You can visit our website www.neelkanthhospital.com. Other than the Gurgaon branch, we have branches in Agra, Lucknow and Aligarh.